request Dr. Ramchandra Lele, Director, Department of Nuclear Medicine at JSLO, to give his talk, please.
Madam Chairman, in the next 10 minutes, I will make only one important point. In 2004, there was an Asian Health Insurance Conference, and I gave the keynote address. 2004, and my scheme was health insurance as it exists is always making losses, and therefore the only solution that I gave in 2004, add health insurance with preventive care. 1 rupee spent on prevention will save 5,000 rupees on cure. Unfortunately, 10 years have gone and not an inch of progress has been made, and still I have not lost faith. At the age of 86, I cannot make 5-year plans, I make 1-year plan. So with my PowerPoint presentation, if all the people here agree, before the end of 2014, we can have a workable plan in the city of Mumbai, which I call Mission Mumbai Health, where I have done a survey that the 80% poor people, they don't need charity, they need empowerment. Today, Dharavi patient, when he falls ill, in 1 week's time spends 10,000 rupees. I am giving for a whole family for 2,500 rupees a month. I am giving a 5 years policy, and he pays 200 rupees per month through a self-help group, something which is workable. So unless we are very mediocre and stupid, there is no reason why within the next 6 months my Mission Mumbai Health cannot succeed. And I will give you the actual details. You please study the PowerPoint presentation and ultimately see what are the plans that I am giving you. I will give you actual agenda of how my scheme can success. Micro insurance and microfinance. Dr. Ila Bhatt has shown in the Ahmedabad experience that health insurance has to be within the mandate of microfinance, and I am looking for a microfinance company who will give me 6,000 crores tomorrow with the assurance that he gets 25% interest and in a 5-year period he recovers. I am waiting for people to come out with this scheme, and with 25% interest, which is a bankable proposition, but I will show you how. What are the characters of my scam? Each old man after the 60 gets a pension in my scheme, and I will tell you what are the features of my illness. I am suggesting that the Rajiv Gandhi Smart Card, which takes care only of hospitalization, which forms only 10% of a poor man's illness. So my bronze card will supplement your card, and for 200 rupees a month for the next 5 years, the entire poor population of Mumbai can get health insurance with preventive health care from day one. What are you waiting for? What are my schemes? Ila Bhatt has shown very carefully that her plan is working very successfully, and I will show you all the features of my scheme in the next 5 minutes. C.K. Prahlad said, for the fortune at the bottom of pyramids. Dr. Velumani is going to be my partner in my health insurance scheme of preventive care, and he will help me to provide diagnostic tests for the bottom of the pyramid. And I have listed the test. He is my active partner, and he will see the potentiality. 23 million people of Mumbai. In 2011, I went to Taiwan. The entire population of Taiwan is 23 million. Every citizen has health insurance. He carries a card. When he goes to a hospital, his electronic record is there. But Taiwan is making losses because they have not added preventive care. So I told the Taiwanese that I am going to do better than you, because I am adding preventive care and this health insurance card with preventive care, and I calculated that the 1,500 crores losses that health insurance company are making, and the 6% that is due to TPA, the 2,100 crores, I can pay one family doctor 1 lakh rupees per month for taking care of 1,000 families, it's 5,000 people, and I give him a laptop computer, he will have electronic records. The technology is there, the opportunity is there. What are we waiting for? Now, what are the salient features? Maintenance of continuous healing relationship of a family physician with a voluntarily enrolled population, one family physician for 5 to 1,000 families, to provide promotive, preventive and curative care for 3,000 to 60,000 individuals per week. But the family physician will get a monthly income of 1 lakh of rupees. He does not have to do unethical practice. Today the practice of Mumbai is so commercial and so shameful that I am allowing him ethical practice of medicine by taking 1 lakh rupees per month. Physician and multi-different specialty terms can design and execute best care. We do not need a TPA. The medical profession itself takes the responsibility. Hospital facilities, complex diagnostic equipment, laboratory investigations are deployed on a basis that can be used with greatest efficiency and economy. Electronic patient record and computerized prescription are part of my care. Every family physician that I am going to employ, I am giving a laptop. I am giving him all the knowledge base. And every patient of mine has a mobile. My maid servant, my cook, my sweeper has a mobile. So when he becomes my patient, through mobile communication, I can give contact with him and I'll send a reminder. You are a diabetic. Your next hemoglobin A1C is due tomorrow. Go to thyroid care and get it done. Look at it, potentialities. We are so mediocre that 10 years this message I am shouting and still we are not making progress. So I feel that this platform is the best occasion for me to say that if you accept my plan today, before the end of 2004, we can have a reality of Mission Mumbai Health, and we do not need charity. The poor man is willing. I have done survey in Dharam, आपका कब आता है? 80,000 taxi drivers, 5,000 workers, आपकी policy कब आने वाली है? People are ready, and we are not ready yet. The approach is most effective in cost control. In the current free for service scenario of medical practice, new single source patent protected drugs are aggressively promoted by drug manufacturers. If I write a prescription of 30 rupees, I get 5-star hospitality to attend a conference. If I get 1 rupee drug, I don't get hospitality. So in my scheme, 350 essential drugs will be given at a cost, and that is one of the biggest contributions to get. The poor man's expenditure, 50% is drugs. So if I can give him drugs at a lower cost, that is the biggest contribution I will be able to make.
Escape. Left-hand top escape.
Okay. Impact of preventive care of lifestyle will be measurable in drastic reduction. By 2025, India is going to be the capital of metabolic syndrome, the largest number of diabetics, hypertensive, atherosclerosis. So if prevention can start today, we can prevent the diabetic capital 25. Who will do prevention? Family doctor. And let me know, 600,000 doctors of modern medicine, 600,000 doctors of Ayurveda, and 400,000 doctors of homeopathy, all can do preventive care. As a teacher of medicine, I can tell you that I can take the 600,000 Ayurvedic doctors and 400,000 homeopathic doctors, and I will train them to take preventive care. All of them are capable of preventive care. And with standard computerized prescription, I will see that they are. So manpower is not a limiting factor at all. A very important message here. A chamber managed care will not only ensure the elimination of the widely prevalent gender discrimination against females, it will actually put major emphasis on the care of the mother, female child, adolescent girl, example nutrition, menstrual hygiene, sanitary napkins, prevention of iron deficiency, sex education, prevention of STD, HIV, emergency contraception, family life education, women's, all can be done through my family physician who can be easily trained for it. So this is the most important message I am giving you. Care of pregnant women will ensure that no baby is born at a birth rate of less than 2.5. Unfortunately today, 60 lakh children are born every year with a birth rate of less than 2.5. These are going to be the diabetes and hypertension. So a very simple challenge which can be started today is to make sure that no baby in Mumbai is born with a birth rate of less than 2.5 by giving preventive care, something which is easily possible. So this is my action plan. Bronze card, 2,500 euros per annum. Through self-help groups, each member pays 200 rupees per month in a bank account. So in the next 5 years, she repays. Then she gets a new account. Something which is easily possible. And what do you get? Life insurance for the breadwinner. Accident cover and health insurance for everybody. Today, everybody in Mumbai can be knocked down by a truck while crossing the street. So accident cover for every citizen of Mumbai is included in my plan. No exclusions, preventive care and pension for people above the age of 60, all included in this plan. Unusual features, preventive dental care, preventive mental care, accident prevention, blood donation directory. Velumina is my partner who will give me all simple tests for the bottom of the pyramid, not the middle. All these components are mentioned there. All the details are given here. So my urging to you on this platform is Mission Mumbai Health is not Mission Impossible. I know it is not a trip to Khandala, it is counting Mount Everest, but Mount Everest has to be climbed. So what are my partners? Jayan Bhantia, ex-Chief Secretary of Maharashtra Government, Municipal Corporation of Bombay, Rotary Club of Bombay, Sneha Almeda Fernandez, Kevin Bhatnagar, who is an international specialist on pensions, who have promised me how the pension scheme can be implemented with Pro Mumbai. Arogya Bharati, Swasthya India. So ladies and gentlemen, if all of you agree, the plan is very possible. Within the next 6 months, if the ground of Maharashtra and Parental take place, this can become a reality. You can download my PowerPoint, study it carefully, but I cannot make 5-year plans, I make only 1-year plan. Thank you very much.
Thank you very much, Dr. Lele, for your very insightful ideas. And indeed, prevention is much better than cure. And I take this opportunity to inform the audience that the Maharashtra government has already taken a step in this direction by declaring a prescription-free program in all the rural areas of the state, in all government hospitals. 350 essential drugs are being distributed free of cost for the last few months now, and now we are making a beginning in the municipal corporation hospitals also. So we hope that through these measures we will take care of at least 40% of the retail market for medicine in the state. And definitely we can work together on the kind of ideas that you suggested. Thank you.